Okay, we're here with Dr. Robert Fink in Chicago, Illinois at his office, downtown Chicago, Gold Coast, and we're talking about a technique that he performs down here called minimally invasive spine surgery. Dr. Fink, please explain the specific problems associated with the back that would require your surgery, the minimally invasive spine surgery. So the specific problems, the main things that it would require.
The primary reason people are coming to us here at Gold Coast Orthopedic Spine and Hand Surgery is for herniated discs in the back. It's the most common problem. People are having pain in the back. It often will radiate to their buttocks and down their leg, decreased feeling in their leg, weakness of the leg, and incapacitating pain in the leg. These are the symptoms that patients are presenting with that have a herniated disc in their back.
So that's a herniated disc. That would be the main reason to have minimally invasive spine surgery, correct?
Other problems with that is our main, or
that's
the
number
number
one
one problem.
Yeah. All right. So can you explain and show the people out there the what a herniated disc looks like with your model?
Okay, this is a model of the spine. This big thing is the spinal cord. Everything that is white is the bone. This is the backbone. We're now going sideways. Everything white is bone. There's a little hole we call a neuroforamina, which is like a branch off of the spinal cord. And then I'm showing you in the front of the spinal cord, again we have bone, but we have in between the bones discs. These are little cushions in between the bones in front of the spinal cord. What happens with a herniated disc is that there's a herniation of the hard jelly that's in the center of the disc that allows for you to turn and compress your spine. Part of this hard jelly moves. It moves backwards, causing back pain. It can move and hurt a nerve. In this case, this one is pressing against this nerve. That can cause pain in your buttocks and down your leg and decrease feeling in part of your foot. So this would be the herniated disc, this red portion here.
Okay, so staying on the herniated disc, okay, can you explain to the people that are watching this the alternative to your type of minimally invasive spine surgery and compare the downtime and factors such as that? So compare the old way of doing it right now. So minimally invasive spine surgery, you would do what?
With our technique, people come into a surgical center. We make a small incision in the operating room, often with just sedation anesthesia. We're able to go to the disc without disturbing very much of the other anatomy, take out part of this herniation of the disc, and then put a Band-Aid on their back. They go back to the recovery room and they're able to walk to their car.
Okay.
The other technique, the older technique, involves being in a hospital either overnight or for 2 days. You have a cut on your back. Sometimes you even have to have 2 nurses helping you out of bed the next day, and it's a much longer rehabilitation time.
So basically this is like night and day comparative, and pain and downtime and scarring and all that type of stuff. This is more like a procedure as opposed to an operation, you're saying?
Well, if this is an operation, it's just done minimally invasive with less trauma to the tissues, less recovery time, and people are benefiting.
All right, can you say, tell us how people herniate their disc, the usual ways that they would herniate their disc, and what it would feel like when you have a herniated disc or you've done the damage to the jelly in the disc?
Herniations come from a variety of reasons. One of the most common causes is lifting something heavy, and then immediately you have pain in your back. You may have pain in your back and later on that day or even at that time have pain in your buttocks and down your leg, decreased feeling in your foot, and people that have unrelenting pain should seek our help where we can help them with minimally invasive surgery.
Does this ever go away? Like if you herniate your disc, will it ever go away on its own, or is it a chronic problem that just really needs surgery?
There are some people that have this problem that are living with the pain, but if it becomes incapacitating, it may.
So there's basically no way to, once the disc is herniated, once it's broken, once this happens, it happens. There's no way of going back to.
You'll never get a normal disc afterwards. There are some people that they can accommodate with the pain that they're having. They can live with it. There's some people that do not want to have a major operation with the scar, like I talked to you about in hospital, that if they knew about our minimally invasive technique, they may want to have that.